Hi, I'm Audra Baum. I'm here with Dr. Jeffrey Rappaport, and we're discussing the 10 secrets of acne scar removal. What are the types of acne scars?
This chart describes the individual types of acne scars. It's important in your consultation to have them delineated.
What treatment works best for each type of scar?
For the boxcar type scars, we use the TCA cross and we use the Fraxel laser. For the deep pits, we will use excision and we will use TCA cross. For the deep rolling scars, we use subcision and we use fillers. We want to raise up these type of scars. For the shallow pits, we will use Fraxel and TCA cross. For the shallow rolling scars, we use subcision, we use filler, and we will use Fraxel laser. And then for raised papules, what we will do is we will use a fractionated CO2, which is the fractionated aggressive vaporizing laser, and we will vaporize the individual papules or bumps. A lot of people come in and ask about pits, which are really enlarged pores / acne scars, and for that, the regular Fraxel Restore is by far the best treatment we've ever had for pores or little pits.
What are fillers?
Fillers have been used for a long time in treating acne scars. However, another little secret is that if the scar is bound down and you decide to put a filler in, you're going to end up with something that looks like a donut hole. The key to using fillers is you have to make sure that the scar is distensible, and when you stretch the scar, that the scar disappears. The most common filler that we use to treat acne scars is hyaluronic acid, such as Restylane, Perlane, Juvederm. It's a naturally occurring substance. When people have deeper acne scars, which are caused by a loss of volume in the face, we use something called Sculptra. When people have scars that are more superficial and we want to treat them on a permanent basis, we use silicone. However, as I said, silicone is a permanent treatment, and if there are any problems with silicone, it's more difficult to correct the problems than something like hyaluronic acid, where we can just inject something to melt away the filler. The hyaluronic acid fillers, when using to treat acne scars, tend to last about somewhere between 7 to 10 or 12 months. The silicone is permanent, and the Sculptra lasts 2 to 3 years.
Tell me about the Fraxel Restore laser.
The Fraxel Restore was the first of the fractionated lasers that came out. It is considered a non-ablative laser, meaning that it doesn't vaporize the skin but heats columns of skin. The way the Fraxel laser works is by heating those columns of skin. When they're done heating, they are replaced by the body by new collagen and elastic fibers. The rows of columns are put linearly so that they're spaced, and that allows normal skin in between to fill it in, and so instead of taking off layers and layers of skin, you have individual columns with normal skin in between, so the healing can be done from the in-between normal skin. The recovery time for the Fraxel laser can be anywhere from 2 to 7 days, depending upon how aggressive the treatment is. It's often necessary to do 2 to 4 sessions with the Fraxel laser when you're using the non-ablative Fraxel.
Tell me about the Fraxel Repair laser.
The Fraxel Repair is an ablative laser. By that I'm meaning that it vaporizes skin. Once again, you have the laser putting in columns, so you have normal skin in between. However, these columns go deeper and they vaporize the skin. So they can actually, by vaporizing columns, vaporize part of the scar. The recovery time for the Fraxel Repair, which is an ablative laser, is usually about 7 days. So people really cannot do this laser and go back to work as they can with the Fraxel Repair. Most people who do the Fraxel Repair can get away with doing it once or twice. When we have the more severe acne scarred patients, this is the laser that we reach for first.
What is TCA cross?
The most common scars that are treated with TCA cross are boxcars and acne pits. Sometimes even ice pick scars are treated with TCA cross. TCA cross usually has to be done at least 2 to 5 times. What it does, it builds up the collagen underneath in a deep acne pit or a deep ice pick scars, and it fills it up from the inside. This technique is very, very simple and does not have a significant amount of downtime.
I've heard about subcision.
Subcision is a technique where the acne scars are lifted. The way you lift acne scars is you have to cut the tethers that are holding the acne scar down, and that's done with a very tiny little needle with a scalpel tip. And by cutting those tethers and allowing different collagen and elastic fibers to form underneath that, you lift the acne scars. We do a couple things differently, and this is a secret that I'm letting you know. We have the patients take aspirin before so that they bleed a little bit more into the scar and there was more elastic and fibrous tissue formed. The second thing that we do, and this is a new technique, is that we provide patients with a suction device. The suction device pulls up the skin and allows the area underneath the scar to fill up more easily. Subcision produces a permanent result. Most people can recover in 2 to 7 days.
What is scar excision?
Sometimes the best way to remove scars is to actually cut them out. In my hands, I like to cut out mainly the small scars. When you are dealing with larger scars, there's tension on the face and tension on the skin, and the results are not as rewarding. I tell people when they're having excision that they need to plan on having some sort of resurfacing of the face afterwards to smooth out the area that the excision has been done.
What is the best way to get rid of acne scars?
Remember my statement if you have acne scars and you want to get acne scar removal. Lasers don't lift the skin. If you want to get rid of anything that's below the level of the skin, you must do other techniques combined prior to or at the same time as the lasers in order to get the best results. Lasers don't lift the skin. Subcision, fillers, other techniques. So if you want smooth skin, you need to do a combined, individualized, custom approach.